Hi, I'm Gia Nicolaides. Here's your morning brief on the coronavirus. It's day 6 of the national lockdown, and the number of COVID-19 cases are up by 46. We now have a total of 1,353 cases in the country, and 5 deaths. 1 from the Western Cape, 1 from the Free State, 2 from KwaZulu-Natal, and 1 from Gauteng. The first death in Gauteng was confirmed yesterday, a 79-year-old man who had respiratory distress. The good news is that the health minister says that the current rate of infections is not as sharp as they thought it would be. In terms of models that government is working off, they had been anticipating between 4,000 and 5,000 confirmed infections by this stage, but it's still too early to tell if the current interventions are working. So sticking to the rules is imperative. On another good note, the International Relations Department says it will assist South Africans stranded overseas, and it will prioritize those who don't have money for flights or accommodation. However, government has appealed to those who can arrange their own travel to do so. There are almost 1,500 South Africans who are currently stranded overseas. Taxi Association Santaco has called off its strike. They've been given the go-ahead by the Transport Department to carry 10 passengers per taxi for the remainder of the national shutdown. They were initially allowed to only transport 7 passengers. Now, if you were on the MSC Orchestra cruise trip from Durban to the Portuguese islands on the 28th of February and on the 16th of March, the Ministry of Health is looking for you. There are 2 confirmed cases from these trips. The plan to roll out testing and screening across the country will be very targeted, focusing on hotspots. Every patient who is positive has been plotted on a map. They will go to those areas and triage rapidly, search for people with symptoms, test, quarantine, isolate, and treat where necessary. The Health Minister, Willem Mkhize, has warned that life will not go back to normal when South Africa completes this 21-day lockdown. He says South Africans will need to adjust their behavior if the country has any chance of fighting the spread of the coronavirus. There will be a gradual process of normalization, and social distancing may be here still for a while and become the new normal, at least for now. For this and more, go to ewn.co.za/coronavirus.